Good morning, sir.
Very good morning. Yeah. Let's wait for another 1 minute. So let them all resume, then we can start. So a warm welcome and good morning to all of you. So in the meantime, let's have an introduction section. So let me start. So I'm Dr. Paramjot Panda. As in the last session, we already discussed. So few members are also new. Some of them, they know me. So yeah. So I'm the founder of the Utkarsh Research Network Private Limited, and where we have trained more than 500 students in different academic kind of things like systematic review, research methodology, SPSS, R, Stata, data analysis, and guided more than 50 students from different university all over India and world. So this is what about me. So I would like everyone to introduce yourself, and here I'm also interested to know what will be your topic so that we can proceed further. Yeah, we can start with Soumya Shri. We can start with the Soumya. Soumya, are you there?
Yes, sir. Good morning, everyone. I am Soumya Sri Pani, working as an epidemiologist in BMC. So that's all about me. I have done my master's in public health and followed by I have actually I am more interested in this research and all. That is why I'm joining this session. So yeah, that's all.
That's great. That's great. Thank you. Yeah, Mehak Kanwar.
Good morning, sir.
Very good morning.
Sir, I'm Mehak Kanwar. I'm a research assistant at CIPR SOA. Sir, I'm here to learn more about systematic review and meta-analysis since your last session at our institute. And I'm working on basically cancer research right now. So I wish to choose a topic on colorectal cancer metabiotics. And with your help, hope to complete it. Thank you, sir.
Yeah. Vidita? Okay. Niranjan, sorry. Krishna?
Good morning, sir. Am I audible?
Yeah, you are audible.
Sir, myself, Dr. Krishna Biswas. Right now, I'm working as assistant professor in All India Institute, Guwahati. So, my idea to join this course is to learn systematic review and meta analysis since we practice systemic based medicine practice. And my branch is I'm in a department of dentistry. So, we have started here postgraduate course as well. So henceforth, since I joined the class in the previous session also, and I learned a lot of many things. So to continue this journey, I have enrolled in your course, sir.
That's great. I have one question to you. Why do you think that systematic review is going to have an impact on the thing that you are doing? Why not the other things?
Sir, because systematic review, as you the definition tells that it is the review of all the evidence based and the the reviews or the studies or the randomized control trial which are present. So doing systematic review is one of the best thing where if somebody reads through it, one can get the wholesome knowledge about the topic first, and like be it any topic, he can understand what he has to do, and like which like in a procedure, if some kind of procedure is done or a surgery is done, he can know that yes, by doing this surgery or this incision or this pattern, he'll get the maximum result as compared to reading a case report or a case series. So that is one of the basis of systematic review. And moreover, like for publication also, if you are well versed with systematic review meta-analysis, it has highest level of evidence according to the pyramid, as we know. So even the acceptance and the the various things which are related to this will be great, sir, if somebody knows how to do it, because one of our professor in Ames Delhi is the best in systematic review. So now almost he's doing umbrella review, sometimes different type of review scope. So obviously we follow him, so that's why the ignition to start the journey of systematic review has come.
That's great. That's good. That's what I want to hear from you. Great. So yeah, who has left? So that this I am doing is that like we can understand each one of you, because right now we all are one cohort. We all are one group. Okay. So it is the time to learn each other. Okay. And second thing is that I can test whether your mic and camera is okay or not. That is the whole idea is all about. So who is left? Yeah, John, Dr. John. I think your volume is low. So am I audible right now?
Yeah, sir.
Yeah.
Good morning, sir. Okay, I'm Dr. John. I'm from Bangalore, Karnataka. So I am working as an assistant professor in family medicine at St. John's Medical College, Bangalore.
Great.
So I was interested in your talk last week. So I just want to join for the systematic review and meta-analysis. Okay. So I'm new to this thing, so I just have to learn a lot of things from you, sir. Thank you.
Definitely. We will be starting from very scratch. And may I
Okay.
know like what topic you would be choosing? Like the broad.
I, I hope any drug also, any drug comparison or any other communicable or non-communicable disease comparison. So anyway, I am new to this thing, so I have to learn the basics of this thing and research question development, then followed by this thing. I just have to do it off, sir. Okay, thank you for the inspiring session.
Thank you. Let's start the session. So yeah. So before starting the session, here are certain rules and regulations during the session. So I would request everyone. The first rule is that whenever you can speak at any point of time, no issue. So whenever I am talking, just raise your hand if you have any concern doubt, because my policy is that the doubt should not be there in our mind. It has to be clear at a particular point of time when it is being created. So when I am talking, if you have generated any doubt, please raise your hand. And once I finished it, then we can clarify those doubts. That is the one rule. Number two, whenever if someone is talking, please after talking, you just mute yourself so that it will be easy for others to listen, and the sound will be very clear. And third thing is that I want you all to participate, and I want you all to do the work along with us so that it will be easy, because ultimately practice is the key to everything. Okay, so this is the three golden rule that we are going to follow. And with this, again, I welcome you all to the cohort. You all are belong to the cohort 77, and you all are welcome to the URN family. So let's dive more into the systematic review and meta-analysis. So before proceeding, I would like to understand from you, how many research articles have you bookmarked but never read? You can put your answer in the comment. In last 1 week. I'm talking about the last 1 week. It may be 0, it may be 10, it may be 20, whatever it is. Three, 0, 30, 2, 4. So why? Why so? Why so? You have bookmarked it, that means it is very important to you, but you could not able to read it. Anyone? The one with the highest number, I think Amrita. Yeah, Amrita say 30. So Amrita, can you tell me, like you have bookmarked time taking? Exactly. So it is time taking. So a lot of informations are there. A lot of things are there. So that's what we are going to learn about, how we can minimize those things by using the AI technology. And we will be revealing all the secrets one by one. And that's what the role of the SRMA, that is the systematic review and meta-analysis, come. So it is the review of all the articles, like it is more than 50 or hundreds articles. So whenever we are going to read one article, that means we are going to accumulate the information from at least of 100 articles. That is the power of the systematic review. That is the level of the evidence that we all are generating from it. So before that, I would like to share one of the personal story based on the experience that we had at the time of when I was associated with PHFI, Public Health Foundation of India, IIPH. So what happened when I first heard about maternity waiting home? That project was related to the RMNCH project, and at that time I was very new. Like the maternity home was very new to me. That was called in Odisha as Ma Gruha, and I thought that they were just another brick and mortar health initiatives by the government of Odisha and all. I don't have an understanding of about it. It is a whole initiative by someone else that I will be discussing. And when I encountered that, then it was a very nice idea on paper, but far from the transformative. I was thinking, I don't know whether it can be a transformative or not. So then what happened? My perspective changed during an evaluation project. So I have been selected to do the evaluation on the same project, and that too in a very remote tribal block in Odisha. And that is basically the Kyonjhar, Kalahandi, Raigada. These are the districts where we need to conduct this study. And we were reviewing the maternal and newborn health outcome over a 3-year period. Since last 3-year periods, what has happened? What were there in the data? What exactly it is? Who had implemented it? How they have implemented it? And we buried in the data where stories and that statistics alone could not capture, because a lot of informations are there, and it was approximately a more than 300 pages of the document. And then what happened during all those kind of things? So we met with one of the lady, Sabitri, a young woman in her 9th month of pregnancy, who lived nearly 40 kilometers from the nearest hospital. And in the past, women from her hamlet, that we call it as a small group, they would often deliver at home because they could not travel in time. They do not have a vehicles. Even though someone is having a vehicle, because these people are living in the mountains. Okay, it is very hard because the hospitals are there at the down. So it become, even though it is 20 kilometer or 30 kilometers, it become very difficult, and it become very difficult for the people to carry it, to pick them a hold, or to pick them and to bring them to the hospital. And they told us that they will be like, there will be a small chatai kind of things, and where they put 4 stick, big kind of things, and 5 to 6 people they used to carry, and they move from up to down. Or they used to carry the chair, and they make the person to sit over there, and tie them with the hand and with the at the waist, and then move. So it is kind of you just imagine the situation how it was. And they used to spend approximately 1500, 2000, 3000 of rupees, and they do not have capacity to even eat for 3 meals a time, and most of them they are taking only the 2 meals. And what happened? But Savitri spent her final days of pregnancy in the Magruha facility, because that was there in the nearby to it. So what happened? This Savitri has been informed by the Ashas and Anganwadi, and she has been bring to that center. And again, there were a lot of challenges, like if they will be coming, like who is going, because like for us, if someone is pregnant in town areas, they will take rest and all, right? The doctor is saying you need to take rest. But in the tribals area, it is very common. They are saying that, oh, it is the part of the life. And they used to work, they used to go to the field, they used to do each and everything, right? So what happened to the Savitri? Savitri spent her final days of pregnancy in the Magruha, that we call it as the maternity waiting home, and just 500 meters from the hospital. And when labor started, she was wheeled into the labor ward within a minute, and her baby was born very safely. And she received the postnatal care, and she would never have had at home. And that's what the numbers told the same story on a large scale, that the institutional rate in the catchment area had risen by more than 30%. And this is what I'm talking about, approximately 2020 data. And these cases of delivery related complication began managed within the golden hour, which had doubled it. And that's where I realized that the Magruha wasn't just a building, and it was a bridge between inaccessible village and life-saving maternal care. And how did we know about this all? It's we talk about the systematic approach in public health, and I want you to remember this, that sometimes the most impactful intervention are not about the inventing the new technology, but about connecting the people to the right place at the right time. And this is what we understand from the systematic review that we had spent and did before doing this exercises and developing a report of more than 200 pages, and which help us in understanding, because even at that time I was not aware about what is systematic review, number one. Number two, I was not aware about the Magruha itself. So here is one more lesson, is that even we can choose a topic where we are not mastered into it. The only one thing is that the interest should be there. That is the key point. The interest should be there, because we need to work a long period of time. So interest is the major factor. So this is the some of the glimpse that we did it, and at the time of doing the data collections, at the time of understanding the Magruha concepts and all. These are the peoples who are waiting outside, and in the tribal area it is very obvious that if one person is coming, the whole family members, or sometimes even the whole village members would be coming to the place. Okay, everyone would be coming to the place, and they will stay there, they will bring their food, everything. Just imagine, from all those 40 or 50 kilometer, and they hold it on their head and hold it on their back, and they bring to the down, and then they cooked food, and slowly as the progress, they see the progress and all, they will move to their village, and by the time of the delivery and all, 3 or 4 person would be there. These are the certain different challenges that that has been arised when we went and see the no, see the right scenario. Again, see the whole family members are there, see their children and all. Here I quoted some of the quotes like what they have been talking about. Here they are saying that I feel good here. I like the behavior of the Didi and other staff. The food they gave is also good. And I came here with Asha Didi and I am staying happily here as I don't have to do any work and taking rest only. That's what he's talking about. That was the current beneficiary, she was saying. And here what? Here is the key. Here is the Asha Didi. She came with the Asha Didi. So how did we understand these kind of things? Who will be the person? It is the systematic review from all over the world which gave us the insight, which gave us the experience that who would be the right person to do that. And this is what this example, the whole story, I set it to make you understand that how does it is not only about the story of the secondary data research, that how does a secondary study, secondary data research can also be put into the intervention kind of thing, can also be put into the new activity or new intervention that we can do, and then it can lead to the policy changes and all. And there is another quotation from the ex-beneficiary, and she said that the stay at the Mahagruha was pleasant and they have served good food to us. And I will definitely tell other pregnant women to go to Mahagruha for delivery. So this is again the another component that if the service is being provided at the utmost quantity, then there will be a more likely to get referrals. Because if from the one village, if one of the beneficiary is saying, yeah, it was good and I didn't feel the pain, I didn't feel problems and all, it was very nice, so and so, then the other people will be also interested and they will be come down. Because the problem is that they have to stay at least of 10 to 15 days in the maternity home, and they thought that who will be preparing the food, who will be take care of their the domestic animals, right? Who will be take care of the hen, who will be take care of the the temple if it is there, who will be take care of their grandparents. So these are the certain issues they used to say, and here based on the systematic review and meta-analysis we try to understand all those components and how does in other countries or in the other place they have addressed it. So we also try to do same thing. Here is the another quote, that most of the areas are hard to reach and we are facing difficulties in reaching there. And in some areas like Hatibari, Naxalites are there too. So we hesitate to go. And conveyance facility is also very poor and we have to take auto from the nearest place which is costly and we have to pay it from our pocket. So this is what is the from the male worker, okay, and he was talking about that. And then the Odisha government has introduced about the motorbike ambulance. The ambulance has been attached with the motorcycle, and this, if someone is interested by Asha, if Asha informed, this motorcycle will go there and they will bring. So that motorcycle has been designed in such a way that two people, like one mother and her small child, if it is there, they will be accompanied. So that was the different innovation has been coming out. And also, we need to understand why the systematic review. And this is what is the whole story about the systematic review. And then the Department of the Health Research, Ministry of Health and Family Welfare, Government of India are now always looking into the systematic review. As one of our friend also said that systematic review is the one which help us in providing a vital information. So with this, we understand that what is a systematic review. So a systematic review is a review of the evidence on a clearly formulated question that uses systematic and explicit method to identify, select, and critically appraise relevant primary search and to extract and analyze data from the studies that are included in the review. Okay, so this is what is all about the systematic review and understanding. So may I know about the whole story? What did you learn from it? Or if you have any doubt, any concern, we can discuss on this. Yeah. Any comments? I want comments. Okay, great. So, so the take home message is that in the systematic review, whenever we are doing it, so it doesn't matter about the topic that we have a knowledge or what, number one thing. Number two is that if we are going to do a systematic review, we should be having the interest in it because we are going to follow a number of the steps which is been already explained by the Cochrane itself. So let's dive more into that. What are those steps? What are the steps of conducting it? And what are the things that we need to keep in our mind so that we can proceed further? Give me 1 second time, 1 minute time so that I can link it to you with another system. Yeah. Yeah. Is my screen is visible?
Yes, sir.
Perfect. So So before proceeding with the systematic review, we all understand what exactly is the systematic review, right? And don't worry about just listen to it, whatever I am telling, okay? Because all the notes are with you only, okay? So don't worry about the notes. And if it is important kind of thing, just write down the in a bold heading into your note. So the systematic review, as Dr. Krishna is also have also said about that, a lot of different types of systematic reviews are there, right? Yes. So we should, before proceeding with the systematic review, we should be understanding what exactly are the different types of the systematic review and what does it mean to us, so that it is going to help us in determining what what kind of things that I want to do it, and I can be able to choose the type of the systematic review for my own review. So that what is the important part of it. I was just checking whether recording is okay or not. Yeah. So this is what. So we have learned that uh, what is systematic review. Okay. So there are different types of systematic review, and basically these types are depend on like the methods of the systematic review, what we are doing it based on the intervention kind of things. If it is like a intervention kind of thing that is related, that is called as the intervention review. So that is the what we did, the Magruha. So what are the effective strategies to increase the institutional deliveries among the tribal communities? Okay. So that's what is the example is the effectiveness of the cognitive behavioral therapy for reducing anxiety in adolescent, a systematic review and meta-analysis. If someone is interested with a diagnostic, like a lot of diagnoses are available for a particular kind of a disease or particular kind of things, okay, and we are very much interested to know out of 2 or 3 diagnoses which one would be very effective. So we have that's what we want to know about the sensitivity, which tell us how accurate it is, right? So 3 or 4 diagnostic tests are there. Out of that, which one is good, which one is having the highest sensitivity? So that's what also is possible. And if we are going to do that, then the systematic review will be called as a diagnostic test accuracy review. Similarly, the prognostic review. So from the here, the name itself, the prognostic, that means that the something which is which is continuously working, which is continuously progressing. And this review explore the factor affecting the outcome of disease or treatment. Just like a cohort study, prospective study, we are observing the things. So here it is a prognostic factor for survival in patients with advanced lung cancer. A systematic review. Then we have a qualitative evidence. Someone of you may be interested in qualitative study, and you may be interested, like for example, I showed to you in the whole story about the Magruha. So there also, like I want to generate, I want to gather the information. What are the we did this, the qualitative evidence synthesis before the Magruha intervention that we have planned it. So what we did, we formulate the research question, identify it. The main research question was that what was the different barriers from the beneficiary perspective for the maternity waiting homes? Why do people hesitate to go to their maternity waiting home? This is what is the research question that comes to our mind, and based on that we develop the whole things. So if your review is based on the kind of a perception, kind of the things, the barriers, right, in terms of the qualitative part, so that's what we choose, the qualitative evidence synthesis. And when we say the qualitative part, it is all about the words, it is all about the information, it is all about related to the pictures, it is all about related to someone's feeling. That's what is qualitative. And when we say the quantitative, it is all about the numbers. We talk about the prevalence, we talk about the incidence, we talk about the odds ratio, the numbers. Whenever it is number, we call it as a quantity. That's why it's become a quantitative evidence synthesis and qualitative evidence synthesis. So yes, most of the research enthusiasts, they used to ask me, sir, like, is it possible, can we do a systematic review on a qualitative study? The answer to that is yes. Yes, that is also possible. You can do a systematic review on qualitative part also, because if you do that, then only you will be understanding what are the barriers. Because a lot of qualitative studies have been limited with the sample size, only 5, 10, 15, 20. And just imagine if you are going to generate the information from 200 or 400 or 500 participants on which will be having more than 50 articles from all over the world. That will give us a lot of information. And then we have another kind of thing that is called a scoping review. So what is scoping review? A lot of people are confused about then what is review of literature? What is scoping review? What is umbrella review? What is systematic review? So what are the difference between the review of literature, scoping review, systematic review, and umbrella review? If all are there, then what is the need of it? So always remember the systematic review, from the name itself, it's a systematic way of doing a review of literature. This is the layman term. Just remember this thing. Whereas in the review of literature, it is just in a haphazard way we are doing it. Research question is not there. So what will happen if the research question is not there? It is just like things. Suppose you people want to come to New Delhi to attend a conference, right? So what you will do? You will catch the train which will be going to the New Delhi, right? And what about if you do not have a proper aim? What train you would be catching? Depend on the train, what is coming, depend on the mood, depend on the like that you would like to catch what train. You may like to have double decker train, you will catch that. It is not bother about you, you don't concern where it goes because you do not have the purpose. So this is what is the important of the things. So the normal review of literature, they do not have a research question. So that's what it become a scatter kind of things. However, in the scoping review, it is again the advanced form of the review of literature. Research questions are also there. However, it is not so systematic. And always remember, the scoping review is all about from the elsewhere, the Scopus Index Journal. Okay, so that's why the term has been called it as a scoping review. So that means you will only be extracting from the database of the Scopus indexed. That's the elsewhere public review. And when we talk about the umbrella review, the term umbrella means a chhatri, right? So when it is an umbrella, that means the review of the review. That is the, if you are going to do the review of the systematic review, that is called as the umbrella review. Just imagine how powerful it would be, how precise information it will be giving to us when we are going to review the systematic review or the meta-analysis. So that's what is called as the umbrella review. And then we have another kind of a review that is called as a network meta-analysis. So the network meta-analysis, what does it mean? So like for example, we have a non-communicable disease, hypertension, diabetes, cancer, right? So what happened? It is having a cause, it is having a web of causation. There is no one cause which will tell, okay, this is the cause of the diabetes. A lot of multiple causes are there. It could be because of genetics. It could be because of sedentary lifestyle. It could be because of stress. It could be because of some reaction with the drug. It could be because of the dietary. It could be because of multiple kind of thing related to the age, related to the stress, related to the food, and so on. So can I ask you one thing? Like, anyone tell me what is the cause of diabetes and hypertension? One cause. I want one single cause. Is there anything? Maybe I may not be knowing about it.
Sir, it can be diabetes and hypertension for both. Stress, lack of exercise, or for diabetes, it can be genetic. Or
Exactly. That's what I'm saying. So there is no only one cause, right? Like for example, if we are saying that the person is having a COVID, what does it mean? Huh? COVID is there, right? How does that COVID is happening? Only one thing, right? If I can say that someone is having malaria, malaria parasite is there. Can the person is having a malaria because of the stress?
no, sir, it is totally vector one.
It is totally
Parasite.
vegetable that
Yeah.
we know. So similarly, for one disease, one cause is there, right? Similarly, for diabetes or the hypertension, is there one cause? The answer to that is always no. No, right? Someone says yes, Amrita and Nivedita. Yeah, I think obese stress and lifestyle. No, there is no one personality lifestyle stress. Okay, okay, that was different thing. Multiple, yes, exactly. It is having a multiple etiology. So that's what we call it as a web of causation. There is no one thing, web of causation. So now in that web of causation, as a policy makers are always interested, so there would be a maybe a 10, maybe more than 10, but these 10 are the top one, top 10. And out of these top 10, which one would be the first major, instead of calling it as a cause, here we call it as a risk factor. So the questions comes over here is, what is the major risk factor for diabetes? Yeah, can anyone please tell me the answer? What is the major risk factor for diabetes? Major risk factor. That means you can rank it number one. Can anyone? No. Hypertension, sedentary lifestyle, insulin resistance. So still variant is there. If number one means number one, right? So still variant. So now, okay. So Rashmi said that no, and then say hypertension. So may I know, Rashmi, why did you say hypertension? Rashmi, are you there? You can unmute yourself. Okay. So then we have, yeah, Someshri, she said that obesity. So Somya, can you tell me why did you say obesity? Not able to
Uh,
unmute. Sir. Wait, okay, second, not able to unmute. Rashmi. Yeah, carry on. Somya. Yeah. Yeah, Rashmi, you
Sir,
can,
am I audible?
you're audible. Tell me.
Sir, obesity increase the risk of type 2 diabetes in the primarily by causing insulin resistance.
Correct. Correct. Is it the number one? You said
Yeah,
obesity. My question is that what is the number one risk factor for diabetes? You said obesity. So my question is that how did you come to know that obesity is a major risk factor? That is my question to you.
so there can be multiple risk factors. How can we?
Yeah, not sure. Good. Then we can, okay, you can mute yourself. Soumya, we will discuss. Okay. Then Amrita, need research to know exactly the highest risk factor. Great. Need a research. So here she mentioned a very good thing. Need research to know exactly the highest risk factor. So that's what we need to understand. So whether the research has been done or not. If the research has been done, then out of that, what is the factor which is having a highest risk factor, which is the highest risk factor. Global burden of the disease, if you go and see the global burden of the disease, they have ranked it number one, number two. Like a few months back, they were saying that cardiovascular disease was the major cause of death in all over the world. So now the question, okay, so let's do one exercise right now. So right now, how many of you are aware about the global burden of disease? Comment in the chat box. How many of you have know about it, or how many of you have heard this is first time from me? Global burden of disease. You know about it, heard of it previously? Okay. So some are there who heard of it previously, and some are there heard of it previously. Yeah, so most of us have heard about it, so that's great. So you must have seen that, right? The chart, so where they were talking about the number one, number two, number three, the ranking system. Yes, heard about it. That's great. So almost everyone has know about the global burden of disease. So the my question is to you all, how does how does these people will be able to say this is the number one, this is number two, this is number three, this is number four, and this is number five? How?
By doing the research.
They did the research. Yes. Let me tell you, they didn't did the research. Instead, they did the estimation. Okay. So global burden of disease. So global burden of disease as per the evidence. Yes, that's what, as per the evidence. So that's what we are going to learn about. That is the major important thing in the systematic review, that we will be able to estimate the things. We will be able to know out of the 10 things, what are those 10 things which create a problem, which is difficult to tell us. Like right now we are facing difficult, right? We are not able to say what is the number one cause of diabetes, what is the number two cause of diabetes, not sorry cause, it is the risk of diabetes, what is number three, number four, number five, number six, number seven, right? And that's what we are going to learn in the upcoming weeks and all, how we can quantify the things, and we will be able to say number one risk is this one, number two is this one, number three, and number four, and number five. Okay, so now my question is that why it is important for us to know the ranking of it? What will happen if you know the ranking? What would happen if you know the ranking to you all? What would happen if I know the ranking? If ranking is not there, that is okay. For the prevention, for the intervention can be done. Exactly. Exactly. It is because if we know कौन सा है, which is the major one, which is a major risk factor, and then accordingly we can plan for the intervention. And जोन सा major risk factor होगा उसी के ऊपर if you are going to plan the major intervention, तो क्या होगा, हमारा काम easy होगा. We will be getting the result of it. If our motto is to, like for example, right now we all are knowing that how does the diabetes is rising day by day. If we know exactly the major risk factor, we will be working on that, right? We will be working on that. We can plan for the policies and allocate the health resources accordingly. That's what is the major things. because we are a developing country. We are more than the developing country, and we have a limited resources. And the important thing is that how judiciary, how precautionary we need to utilize these resources so that we will be getting the ultimate benefit. That's what is the things that we can do, right? Yes, we can plan for the policies and allocate the health resources. Exactly, that's what. So, so how we can do that? We can do that by doing a network meta-analysis. And you must have seen those graphs in the that global burden of disease, the with the small dotted line, with the single line, with the bold line, with the thick line, with the thickest line, and all, right? So that tell us about which one is having, the one which is having a more thick line, that is more aligned with each other. That is, we can say in term of scientific language like that, they are having a more association, that is more significant. So that's what we are going to learn in the network meta-analysis. That means if your research question in such a way, you will be looking for a kind of a thing where you are going to network. And from the network, if you want to understand which one is having a major risk factor, okay, or out of the 4 or 5 risk factor, which you need to rank it something, then it would be wise to go for the network meta-analysis rather than that of simple systematic review that won't give you the answer of it. So the purpose of telling this to you all is that, so based on what we are interested of, what the problem we are going to solve it, based on that we need to select the systematic review. So yeah, it's again thing different. We have enrolled for the systematic review. Then again, yes, we are going to cover each and every component. Okay, don't worry about it. So first, because all the components, whatever it is, the basic component of systematic review remain the same. There are different things. Okay, so we will be learning all those in the upcoming days. Okay, what are those different things? Okay, so don't worry about it. And then we have another systematic review that we called it as a living systematic review. This is very trending and right now, and this gives the very high evidence, very high evidence. So what they are, these review are continuously updated as new evidence emerge. So it is not like that. Okay, let me ask you one question. So may I know how many of you have publication, any domain, any topic? How many of you have the publication? Yeah. Yes. Perfect. So, yeah, great. Everyone, most of you have publication. Now, you tell me, after publication, did you, how many of you have, after the publication, you have updated and provided the new information to it? Anyone? It's just like a data. So we are using the mobile phone, right? So it's been updated. So this is Android 11, Android 11.2, Android 11.3. We updated. Similarly, to your article which has already been published, how many of you have updated it? Yeah, comments me. Taking so much of time? I don't know why. No, no, not getting, sir. Perfectly, as it is. So just imagine what would happen to the evidence that you have provided after 1 year or after 2 years. That will be the outdated. That is the old one. That is obviously is the cross-sectional study. That is a snapshot. Agree. But with the course of the time, like for example, the diabetes and all, the new risk factor has been emerging. The new risk factor of using the mobile, using the screen time. Earlier it was not there. A lot more. So if we are going update the things every time, that's what is called as a living systematic review. Okay. If our motto is that, we can go for it. We can choose it. Then we have a economic evaluation. If any one of you are interested in the economic kind of things, right? The cost effectiveness, let's say we have a two program, and in the in both the two programs, we are interested to know like which one is effective, or for one program, let's say 2 or 3 different interventions are there. So which intervention is going to give more result with the less cost? That's what all the policymakers are interested, everyone, right? So if we are indulged into those kind of things, we can go for the cost effectiveness kind of things. It is similarly kind of one of the doctor, he said that he is more interested in the medicine, like the effectiveness of the medicine for a particular disease. So for a particular disease, for a particular kind of condition, there would be more than 2, 3, or 4 medicines are available. So out of those, let's say 4. So out of those 4 medicine, I may be interested which one is more effective. Which one is more effective? Not only effective, but also the cost. For example, a medicine cost me 200 rupees. Help me in reducing the fever. Another medicine of 5 rupees help me in reducing the fever. There are people who are buying 200 rupees. There are people who are also purchasing for 500 rupees, 5 rupees. Right. So that's what. So for example, if like the government of India, with the different schemes like the CGHS scheme, railway ministry and all, they are providing the free health service like the Ayushman Bharat. Now in this case, does this scheme is going to choose the medicine which cost 200 rupees, or the medicine which is going to cost 5 rupees? Can anyone answer to this? Nivedita said not getting, sir. Yeah, Nivedita, can you please tell me what exactly the thing you didn't understand? Second one. Cost of rupees 5. Exactly. Because at the cost of rupees 5, we are going to solve the problem. And with 200 rupees, we are going to solve more people's problem at the same cost. That's what, right? Exactly. Second one. Great. Exactly. The second one, the concept is very clear, right? Because ultimately we are going to solve the problem. And by 5 rupees, we are going. Now, similarly, this is what it is very clear to us. Similarly, we need to understand what are the intervention, the policymaker are interested into that. What are the intervention and how much it cost? And out of the 2 and 3 intervention, which intervention is effective? So when we say effective, here two meaning. It should be effective in term of the cost, and also should be effective in term of outcome. So that's what we need to look for. So what are the things that can be done at the low cost and solve the problem? That can also, this if your research question is that kind of thing, that is also possible. even though it is an economic evaluation, no problem, that will be the cost effectiveness, or it is called as the effectiveness study also. If you remove the cost, it will be called as the effective study, effectiveness systematic review. The effectiveness of the medicine for malaria, the effectiveness of the medicine for so and so disease, the effectiveness of A and B medicine, right? Or the effectiveness of A and B intervention. That's what. So if that's what is the thinking, that's what you people are planning, any one of you are planning, then you can easily choose the effectiveness kind of protocol. Then we have another thing that is called as a methodology review. So a lot of the research enthusiasts, they used to say me, sir, already one of the article has already been published. So already the systematic review has been published. Okay, fine, not an issue. What the method they have adopted? If systematic review has been published, did they use the rigorous method of choosing the articles? Yes or no? Try to identify, because ultimately depend on the math. See, the outcome will come automatically. The outcome is not something which which we can create it. Outcome is something which is a byproduct. It is a byproduct of the system. Like the byproduct of this course is that the outcome would be that you will be doing a systematic review. That is the byproduct of the system that I have set it. Similarly, the byproduct of the study is outcome. Outcome is always, it will be coming out. It neither be created. Creation is what? Creation is the methodology. Creation is the developing a research question that we need to do it. And if you do it, if our method is very strong, method is like new thing kind of thing, very robust kind of thing, then automatically the output would be like that. Okay, it is kind of a filter. For example, we are filtering the, like the petrol. We all know that it is a crude oil, right? And it is having lot of things. With the same crude oil, we are getting the petrol, we are getting the petroleum jelly, we are getting the kerosene, we are getting the diesel, we are getting the lubricants, we are also getting some types of natural gases also from that, and even a lot more which I am not aware of it. So this is how from the single product we are getting it at a different layer, right? So that's what. So it depends on what type of filter we are putting it, we are getting. And here if you see all those things, the petrol is different. Can I say kerosene as a petrol? No. Isn't? Can I say diesel at a petrol? The property of the diesel is totally different. The property of the petrol is totally different. The lubrication, we never put lubrication in the petrol tank, right? We always put it in the engine oil, but it is emerged from the same thing. So that's what is the method section. Okay, so even though if someone has did a method section, okay, in one way, and you are also like to do on the same topic, you change the method, that would be the another kind of a review. And don't say it will be giving you, I say that the output, it is something which is coming out from it. Okay, the outcome would be the totally different. Just like from the crude oil we are extracting at the different level, we are getting petrol, we are getting kerosene, we are getting lubricant oil, and so many things. The output is different. Similarly, when we change the method, the robustness of it, you just explore, try to understand what the outcome will be getting it. That's the thing you need to report it. So till now, here we are end with the different type of the study design and all. So over to you guys. So let's understand what did you learn from this? So does it clarify your idea, or is there any doubt, clarification, anything till now? Yeah, I won't comment. Till now, any comment, any doubt, any clarification? All are welcome. Yeah. Does meta-analysis comes under systematic review? No, no, Amrita. Meta-analysis, it's a different thing, and systematic review is a different thing. Just like we have different type of studies, like quantitative and the qualitative studies, right? That the quantitative is like a number and qualitative is like information, right? Similarly, the systematic review and meta-analysis, okay, meta-analysis is a quantitative kind of thing, whereas the systematic review is a descriptive kind of thing. Okay, we only say, okay, this much of article has been there was a type called network meta-analysis. Yeah, we discussed network meta-analysis. Sir, narrative review only we can do only on qualitative study. No, in systematic review, the concept is again little bit different. The narrative review also you can go for a systematic review. Like for example, you need to report, let's say, a prevalence and a risk factor of something, right? Let's say diabetes. Let's take an example of a diabetes. You want to understand what is the prevalence of the diabetes among the tribes and what are the risk factor. And then we are going to report it in a systematic review. Like we got, let's say, 50 article, then we are saying that, okay, in North India this is the prevalence, South India this is the prevalence, right? And these are the major risk factor and all. So we are describing the things. Okay, so here in the language of a systematic review, this is also the descriptive kind of thing, because we are using the secondary data. We are not doing the quantifying the thing, we are not calculating the prevalence, we are not calculating the odds ratio. Here we are just describing what it is there, right? So here it is called as a descriptive study, and that's what we are reporting as a narrative review, kind of a narrative kind of thing. Yeah, so I hope Nivedita, like it is not only with the qualitative but with the quantitative also. Okay, we are describing, so we can go for the narrative review also. So we will be exploring what are the different way of reporting the styles of the systematic review. Okay, so that's what's also we can do. Like in qualitative we have narrative review, we have thematic reviews and all. Similarly we have a descriptive review and all. Okay, so yes, descriptive and narrative can also be there in a systematic also. uh, Next is, does a meta-analysis take primary data? Obviously meta-analysis is always with the primary data. It is like, so what does it mean? So yeah, Amrita, yeah, can you please elaborate what does it mean so that I can explain to you in much better way? Here what I mean is that that means you need to always take a quantitative study to go for a meta-analysis. Okay, and the systematic review and meta-analysis is always a secondary data analysis. So you need to take the article which has already been conducted. Okay, you cannot go for the primary data collection. If you go for the another primary data collection, it's not always the primary data. It's always about in one system what are the different updated data. That's called the living systematic review. It doesn't mean that you will go to the field and collect the data. It is always that what has new been updated and you are updating your old document. Is it clear, Amrita? So narrative review, can we do only quantitative? Does meta-analysis take primary data? Okay, great. Difference between review article versus systematic review. Yeah, so that's what we discussed. In the review article, it is aimless. There is no aim in the review of literature. We do have only the objectives and all. Even though aim is there, that is not. Aim means the research question. Okay, the research question is not there in the normal review of literature. First, second, the methodology is not been described, like कौन से database, what database you are going to choose, why did you choose those database, and in those database what did you select, how did you select those, on what basic did you select, what numbers of article you are getting, why did you choose only 5 articles, how did you, let's say you are reporting in the review of literature 30 articles, how did you arrive that 30 articles. That's all part of thing. If you see the review of literature, you won't find this sort of things. However, in the systematic review, these all details you will be getting. Okay, so that's what is called as the search strategy. They will be reporting the search strategy. What are the different search strategies they have developed, what database they have chosen, how they go for the search, how many articles they have been selecting, on what basic they are rejecting it, how many they are rejecting it, how many they didn't follow the guidelines, on what basic it is, and then at the end they will be reporting the number of 15 or 20. The prisma table. Okay, in the systematic review they used to report a prisma table, that the flow chart of the things. So that would not be there in the review of literature. However, it is mandatory in the systematic review. I hope it is clear, John. Yeah, Amrita. One sharp difference between systematic review and meta-analysis. Okay, you want me of one point. The systematic review is descriptive, whereas the meta-analysis is always a quantitative type of things. Is it clear, or you want more? Systematic review, you are describing the things, you are narrating the things. Okay, in the meta-analysis, you are quantifying, you are calculating the pooled prevalence. Okay, you are doing the estimation kind of things, you do the estimate. Okay, so you will get to know. In systematic review you would not be able to understand which one is the first risk factor, second, third, fourth, and fifth risk factor. Okay, however, the answer to that will always be obtained from the meta-analysis. Meta-analysis is the only one which will tell you about the ranking system. Now someone who is who is doing in the the quantitative, they will be saying the regression is also there. So the philosophy is that whenever we are learning one thing, we need to blank our mind for the other. We should not club it. At the end, when we understand, then we clubbed it. Let me tell you why. It is because even though we go for the regression, we may have like how many in India national survey, only 7 lakh population, right? Only 7 lakh population. This 7 lakh population, I'm not commenting on the NFHS. It's very rigorous. I am putting this comment only purpose to make you understand about the systematic review. Okay, that's what is the purpose. Only 7 lakh population, they are using it, and we all are bound to, we all are agree to that, and that would be the representative of the whole India. They are reporting that the prevalence of diabetes is 40%. We agree 40% is the prevalence of India. They said anemia this much, it is related to anemia. Only 7 lakh 14,000 is the sample size. Okay, yes, of course their method is very robust, no question asked in that. That's why it is the representative of the India, but that's a different concept. So similarly, we need to do for the meta-analysis. So instead of the 7 lakh, we may get more. We need to address the thing which has not been addressed by someone. That's how the systematic review would be there. Read the Lancet articles, you will be understanding like the thing which has not been reported by the the in the NFHS report, and all the people are reporting it in the systematic review. Learn what are the methods they have adopted it. That's what it has been published in the Lancet. And yeah, so always make a habit to read at least of one systematic review or one article from Lancet, not other than that, Lancet or Nature. And I would first recommend Lancet. A lot of concept would be clear to you. Yeah. Let's move. Yeah, any other questions? Okay, great. So here we can take a 5-minute break, and like I'm right here only, you can take a 5-minute break, and after coming from the break we will be going to the practical session, and we will do some of the things related to the thing that we have already discussed. Right now only we will do it. So it is 11:16 in my time. So sharp, you just adjust accordingly. At 11:21, we will be again resuming back. Take 5-minute break if you want. And I'm ready if you want to talk to me to clarify anything. I'm ready to it. So we will be resuming at 11:21.
सर
Yes,
सर एक्चुअली एक आउटब्रेक हुआ है, मुझे कॉल आया था तो
you need to go. Okay, fine. No problem.
यस
कोई प्रॉब्लम नहीं.
सर अगर कोई मतलब रिकॉर्डिंग मिल जाता तो अगर डाउट होता तो मैं पूछ लेती.
रिकॉर्डिंग मिल जाएगा. रिकॉर्डिंग हो रहा है ये सब सेशन. 24 आवर के बाद आपको रिकॉर्डिंग आ जाएगा. मैं ग्रुप में ही छोड़ दूंगा. ओके, यू नीड
जी जी
to arrange it and
यस
keep it in the same place. Okay.
ओके सर.
Yeah. Is everyone is here? Please come back. Yes. Great. Yes. Perfect. Great. Let's start. So let's do the practical. So right now, you need to do 3 tasks. First of all, you need to tell me the topic that you have already done at the time of the introduction. What is the topic that you have already discussed? I want you all in next 10, let's say take 15-minute time, not an issue. You write a research question. Okay. So I will discuss what exactly is the research question to you. So basically, try to understand research question is something which came to your mind, and don't be very cautious like, oh, research question. No, just remove the research from it. Simple, make it a question. Question, when you make a question, it should be always like a based on the observation, based on your perspective, what you are. It can be, why does right now most of the people being diagnosed as diabetes? Why does people are being diagnosed as diabetes despite a lot of interventions? Why does despite a lot of intervention, a lot of people has been diagnosed with the anemia? Why does the government is providing a lot of program like the Ayushman Bharat? We have PHC, we have CHC, but still the more crowd is there in the private hospital. Why does what is the amount that each person is spending for their health? Is the people are spending too much on their health? Is there any strategy to manage this? Is there any strategy to measure the out of pocket expenditure? What would be the prevalence of diabetes in whole world? Is it the prevalence of diabetes is more in other countries like in India? Why does in India people are being more diagnosed with diabetes and hypertension since last 5 to 6 years? Why does this trend has been changed? Right. So these are the research questions that is it should be come from your observation in such a way. So what I want is that on your own topic, then I will be choosing maybe 1 or 2 person with whom we can discuss, then we can proceed further. So similarly, I want you all first make a notebook, write down your topic, the broad topic. That someone is saying diabetes, someone is saying like hypertension, someone is saying out of pocket expenditure, whatever you are saying, put that broad topic. We will be doing the narrowing down, how we can go for the narrow of the topic. Okay. So for the right time, for this time, you just mention the name of the topic, then you mention the research question, and then from the type of the studies that we have already discussed, I know that it is not with you, so I want to see your memory. So write it down, what type of systematic review you would like to do and with why component. Clear? No, not right now. Write it down on your notebook first. Don't put it in the message WhatsApp, oh sorry, this one chat box. Write it down on your notebook. Title, the topic, research question in one note. Okay, topic, research question, type of the systematic you are going to do it, and why you want to do it. These are the four things you do it. Time is 15-minute time. This is 11:26 in my time. So 41, 11:41. Write it down. And if anyone is complete, then we can discuss. Let me put it in the chat box also. So what is expected from you? It is the name of the topic on your subject or interest area. Okay, this is the number 1. So then number 2, it should be the, I would be writing only the question. Then number 3 is the systematic review, and 4 is why. Yeah, so these are the 4 questions you need to answer right away. Please do it right now. Do it, because later you don't have the time to do it. Do the task right away. And if anyone is having any doubt in this assignment, please let me know. Yeah, I'm here only. So if anyone is having doubt, please say, okay? Question means the research question only, okay? The example that I have said to you all, so that type of thing you need to put. It is not the general question, related to the topic only. Exercise on your brain, okay, Amrita? Just don't get it in another way. Like it is there with you all. The Notion link also I have shared with you, okay? Just try to recall from your brain. This is one of the exercise, okay? So this is a part of the learning. Just write down whatever comes to your mind. Yeah, write down whatever comes to your mind. No issue. Hope you all are doing the activity. If anyone is done, please let me know. We can discuss. Yes. So peoples are doing it. So two of the person they said they have done it. So let's discuss. Yeah. So here is Krishna. So let's start with Dr. Krishna. Can we start with
Yes,
you?
sir. Yes, sir. Good morning, sir. So my profession is dentistry. So I'll be I thought about one topic long before because I attended one conference. So they were talking about that topic, but then I tried to find the literature about the topic and its efficiency. So it was not present. So that ignited my mind to do a systematic review on that. So recently we are using this amniotic membrane in the tooth amniotic membrane. So since we know that it has all the progenitor cells and stem cells, so we do root canal treatment. So there is a term where we don't do root canal treatment and we remove some part of the content and put this amniotic membrane and go for regeneration. So this was the basis. So on that, I made that amniotic membrane and its uses in vital pulp therapy, a systematic review. So vital pulp therapy means you are not doing a root canal treatment, sir. So this can be termed as an interventional systematic review.
Okay.
And why I want to do it, because I want to know the effectiveness and the clinical outcome of the specific intervention. That is the amniotic membrane in vital pulp therapy, sir.
So amniotic membrane and vital bulb therapy both are different thing, right?
Yes, sir.
Perfect. You want to know the effectiveness, whether this amniotic membrane or the pulp therapy is effective or not.
Yes, sir. Basically, this because lot of other materials are also there. The bioactive materials which are putting inside the teeth for this vital pulp therapy. So this is the latest. A conference also happened on this only, and lot of people are doing. But when I searched the literature, though I searched in only PubMed, but there was only one or two that to be not related. So I thought, why not to get the a randomized control trial and all trial to get actually what it's working or not, long term outcome. That's why, sir.
Great. So that we will be discussing what are the other component also, which will be help you in refining your topic. Okay.
Sir,
So
sir.
right now our motto is only the three things: the topic, research question, type of the systematic review, and why. And you said everything. One research question is left. Can you tell what's
Yes, sir.
the research question?
Research question, sir. I just told it is amniotic membrane and its uses in vital bulb therapy. I don't know. It is not in PICO format though.
It's
Uh,
okay.
yes, sir.
What we are looking for the research question. Okay, so just refine again. So you just said what that was a statement. That was not a
Yes,
question.
sir.
Okay,
Yes, sir. Yes, sir. Yes,
convert
sir.
it, convert it into the question. Then
Right, sir.
understand more. Okay, so step by step we
Sir.
will convert. Can you convert it right now?
Sir, yeah, I have converted it. That like we can say that does the use of amniotic membrane improve clinical outcome in vital pulp therapy compared to conventional material?
Perfect. Freeze this. Okay, write it down
Sir,
on your notebook.
sir.
Freeze this. I will tell you in the upcoming classes how from this research question. Okay, because this is a key, and for the
Yes, sir.
doc only one key is there, right? So for your
Yes, sir.
study, this is your research question. Okay, and this
Right, sir.
research question will define each and everything. So freeze it,
Right,
write it down. Okay.
right, sir. Right.
Oh,
Thank you, sir.
yeah, Nivedita, ma'am.
Sir,
Yes, please.
sir, actually, I'm currently pursuing my PhD in the area of palliative care.
Okay,
So I have chosen a research question on that area only. So
okay.
my research question is, what are the effects of specialist pediatric palliative care on quality of life, symptom management, and end of life outcomes in children with cancer?
One quick suggestion, ma'am. See,
Yeah,
whenever we are putting a research question, it should be like it is like. Let me give you one example. I'm interested to know more about you. I will be asking only one question. Ma'am, can you please tell me about yourself? Okay. So then you will be describing it in the way. So when I
Okay.
say, ma'am, please describe about yourself, it will be a very huge. And if you want, you can talk about 1 day, 2 day, 3 days, right? So
Okay.
the purpose is that exactly in the same way you put the research question, the research question will be very vast. If your research question would be very vast, then if you go for the further division, like further systematic review, it will be a very vast kind of thing that would be impossible to do it. So all,
Then only quality of life we can put, sir.
yeah,
Not so much variables.
we will go just put it down in a note. Okay, everything
Yes,
what you
already
want.
noted, sir.
Yeah, we will be
Yeah.
discussing that. But always
Yes,
remember,
sir.
for research question, it should be one. Why?
Okay.
Why you are doing? Just put a research question. We are not going for the research gap. That I told you, na, like here we discussed. What is the effectiveness of drug A and drug B?
Okay.
Like that. Okay. Just frame a simple one line, one sentence research question. Then we will discuss, we will be more discussing with you, okay, what exactly you want the things, and then we will be reframing it. But for the purpose of the learning, you just frame only one research question.
Okay, sir.
Okay, yeah.
Sir.
So that's clear. Then tell me, what is the type of intervention and of the systematic
Uh,
review you want to choose, and why?
say into review of interventional studies because I thought I will include the cities, course studies, case control studies.
Okay.
So it is the review of interventional studies, sir.
Review of the intervention studies. That is no term called review of the intervention study. It is the intervention study only. Okay,
Yes.
study will be intervention studies only. That you want to do it. That's great.
Sir.
And then why did you choose this intervention studies?
Actually, I want to uh, find out the target key clinical or psychological outcomes
Outcomes.
for the children, those are receiving palliative care.
So you mean to understand whether the palliative care is effective or not among
Yeah,
the.
yes, sir.
This is your research question. Is
Yes,
palliative care is effective?
palliative care is effective, but which aspect is effective to develop their quality of life? That is my question.
Is the palliative care is effective among so in quality of life?
Quality of life. Yes, sir. I understand.
Okay, got it.
Yes, yes, sir.
Refine the research question in this way, and whatever
Yeah,
we discussed right now, make a note of it. Okay, next when we
yeah.
will be having one-to-one session now, we will try to understand more, and we will fix it. Okay, just write it down, the
Sir.
research question what I said right now, and your point of view, both you write it down. Great. That's
Sir,
great. That's great.
thank you, sir.
Okay. Yeah. Anyone else? Yeah. Anyone else who is complete? Please respond.
Uh, So, effectiveness of lifestyle modification versus health educational program in pre-diabetes improve with HbA1c in adults. It's an interventional review, sir.
Okay.
Effectiveness of lifestyle modification versus health educational program in pre-diabetes improve with HbA1c in adults. So I just want to know whether lifestyle modification or health educational program in a pre-diabetes which may improve with HbA1c without a starting of any treatment.
Perfect. Very clear, because you want to see the two things. Okay.
Two things.
So whether this, out of these two things, which one is effective, and and you also said about the why component also. So your population is very precise. That's very good. So this is the whole your topic. And may I know what is your research question? Hello.
Yeah, so research question is the effectiveness of lifestyle modification compared to a health educational program in pre-diabetes.
No, sir.
Huh.
Uh, this is a statement. Okay.
State.
This is,
Okay.
this is not a research question. Research question always start with is, what, did, or like this. Proper question.
Question. Okay.
So is there is or is there is an effectiveness among A and B? Is A
Hmm.
is effective with B and C among so and so? Like that, you need to start it.
Okay. Okay.
Okay.
Uh,
And okay, so you intervene. Why did you choose this intervention studies?
to compare between two group of lifestyle modification and health educational programs. Okay.
Exactly. Because you are going to compare it,
To
that's why
compare.
you choose the intervention studies.
Okay.
Okay, can you tell me one more answer? If this is the case, you understood, like in the systematic review, we need to collect from the secondary data. That means the article which has already been published. Can you tell me what type of studies you will be choosing for your systematic review?
I will choose RCTs,
Cities?
um, case control
Case con-
studies, case control studies.
Okay.
Mm, yes, so this much. I will search in PubMed, Cochrane, and perfect. Fine.
Can you tell me why did you choose case control and RCT? Why not you choose cohort cross-sectional study?
Cross-sectional. Okay.
Why not?
Okay. No answer, sir. Tell me.
Just make a note of it.
Yeah,
Try to
okay.
make a note.
Okay.
Try to figure it out. Once
Okay.
we will be having one-to-one session, then we will discuss more about it. Right?
Okay. Fine. Fine.
Okay.
Thank you. Thank you.
So yeah, anyone else? Anyone? Okay. So we are running short of the time. So please do this exercise. Amrita, I can't unmute myself. Yeah. Try to unmute yourself, Amrita. You want to discuss? Wait, let me try also. Amrita. Yes. Try now. Yeah. Amrita, you are unmute. Tell me. Hello. Amrita, you are unmute. You can tell me. Okay. Maybe the issue was there. Not an issue. So yeah, anyone else? Okay, so let's move. So we understand. So the whole exercise was to demonstrate you, to make you understand what exactly the research question is, okay, and how we need to form it. And I'm going to show you just another 10 to 15 minutes, okay, like what are the different type of research question, and how we need to frame the research question. Very fast we will be going, okay. Just see what it is and then let me know. Just sharing my screen. Yeah, perfect. Is it visible? Yeah, perfect. So framing the research question is the art, and it is the science of asking the question. So we need to understand what exactly we need to ask, because if we ask a relevant question, we will be getting a relevant answer. That's why we have been trained. Like we have given a lot of exams and all. A lot of questions have been asked to us, And if we answer to the relevant question, then only we will be getting the mark, or else we won't get it. So that's what we want. Based on that, we need to ask the question. So if that is different, the whole study will be different. So that's why framing the research question is a very vital in the systematic review. So whenever we are framing the research question, it must start with how, who, what, when, why, and where kind of things. So this will help us in frame the research question. So what exactly are those kind of things? And they should be have a advanced knowledge about it, and it should contribute to the practice, the resource availability, and then articulating a good research question. A question should define. So what the thing is that what should be there in the question? That means the research question. So basically in the research question, it should define the problem area. What is the problem area? Like someone, you want to do the effectiveness. So the effectiveness of A and B among so and so. So that's what the population is there, and what you want to do, that is also there. That is the problem area should be there. Is a continuous education program is effective in controlling the diabetes? The problem is the diabetes. The solution is we are asking the continuous education program, does it increase the awareness? So this is how we need to frame the questions. Then the nature of the research: discover, explore, explain, describe, or compare the things. And not only that, the outcome of interest should be there. What exactly we want? What is the outcome? Then is there an indication of the relationship? That's most of us we have framed in our research question. Is there any relationship between? Is A is effective than that of B? Okay, if we are choosing A and B, we should be very clear. Why did we choose A and B? Why not the others? It is the kind of like this. This is the mother of a chicken, and she's saying, why did the chicken cross the road? That's what she is asking the question. Because her chicken were not there around her. So what happened? So this is the whole NH, and the hen is here and she's asking the question. So someone says that that is the broad topic. Chicken crossed the road. That is the information. Chicken crossed the road. And Dr. Krishna has used, like, he in the conference, right? In the conference, he has understood the concept of that pulp therapy and the other things, right? So that was the broad topic. And be a chicken. Then why component? Add the question why. Why? So here the similar kind of thing. Someone has asked to the hen, chicken cross the road. Then she asked the question, why did they cross the road? So this devises a purpose statement. If we know why chicken crossed the road, let's say that road was in the Bangalore city, cross roads in Bangalore, we can prevent them from being run over. That is the main purpose of the statement. So that's why the research question is very important. So once we have a purpose of the statement, then we will be help something. Similarly, see the same thing. Now you will understand how does the same thing, it depend on the purpose, it depend on the viewpoint of the research. Okay, let me explore to you. Next question is, he is asking, where and when are chicken crossing the road? Where and when are chicken crossing the road is the another research question. Third is, what factor affect chicken crossing the MG road from Jan to July 2018? what are some environmental factors that occurred in MG Road during Jan to July 2018 that caused chicken to cross the street. And these all have include these 6 criteria. They were very clear, they were very specific, they were relevant, they were manageable, they were focused and interesting. So we should not be able to draft the research question which is not manageable. If that is the case, ultimately then gone. Ultimately हमें ही तो रिसर्च करनी है, हम ही तो करेंगे. अगर मैनेज ही नहीं हो सकता, पहले ही पता है, then how it would be complete? So the solution should be there. So whenever we are writing any research question, there should be a problem area. That is the topic under investigation. What is your topic that you have already discussed? And then based on that, try to figure it out. What is the problem? And then draft the version 1 of the research question that we did right now. We have already drafted this 2 problem. Draft the version. Now the third step is there. You need to propose the statement. Why you people are going for the investigating the things? Why does those 2 things? And then you again need to revise your research question. That would be the version 2 based on this purpose statement. While doing this, so you will be able to draft the very fine, relevant, purposeful research question. And the so what factor always asks the question, be like a hen. So what? Chicken crossed the road. So what? I want to choose the 2 pulse therapy and yeah, so what? I want to know whether intervention A and B to reduce the HbA1c. So what? Why only these 2? Why not the other 2? Why the pulse therapy? Why this? This why component need to be addressed. And let's look some example how it should be. So there would be one research question like, why are social networking sites harmful? Even though this is a research question, but this we call it as a unclear research question. So clear research question is, how are online user experiencing or addressing privacy issue on social networking site such as MySpace and Facebook? Can you please see these 2 and share me with your comments? According to you, this is our point of view. So according to you, what looks good? The first one or the second one? The second one. Perfect. Yeah, most of you saying that the second one. Yeah, second one is clear. So this is how we need to frame the research question. And it should be, we understood that while framing the research question, it should be very specific, clear, focused, manageable, relevant, respond to the so what factor, and well articulated. This is what it should be there. And this is what is the characteristics of the research question that we learned it. Now let's jump to what are the different, because if we know, like we understand what are different type of systematic review, we will be able to figure it out. Okay, this is what is the things I want to do, and this is what I want to, this should be my systematic review. This should be my type of systematic review. We are very clear with that. Similarly, we need to understand what are the type of the research question? Let's dive more into it. So the whole research question is divided into 5 parts. Number 1 is descriptive. Number 2 is relationship, interpretive or understanding, change and emancipation, and mixed question. Okay. These are the 5. Whatever question you ask, it will be more or less surrounds to these things. So let's understand the descriptive. Whenever you are having a descriptive question, it should always start with these 4 components. What is the prevalence? Who are affected during the outbreaks? Where does the outbreak has been affected? When does the outbreak has occurred? Right? So you can formulate a different question. So whatever the question that start with these 4 components, that is always a descriptive kind of thing. So someone asked related to the quantitative and the narrative review, right? So this descriptive is again going to be a narrative review when we are reporting the systematic review. I hope it is clear why, because we are using the secondary data. Okay, and this all are the descriptive. Like this is the few example of it. What is the prevalence of diabetes in X area of India? Who is getting affected with diabetes? What is the profile of the patient with diabetes? Where is the burden of diabetes? High urban, rural, or other area? When did the burden of diabetes start increasing? See, the same topic. So that means the same topic, the 4 members can do it. Okay. And all will be getting the different answer, isn't it? So that's how is the potential. So this is how the clear, if someone is saying that, sir, we are not getting the topic to write a to write a manuscript to go for the publication. See, how many topic you want. This is in front of you. Choose one, write it down. But the purpose is not to get a publication. The purpose is something different. The purpose is always to solve the problem. The purpose is to find out, figure it out, the most important thing. Because ultimately, when we are going to contribute to it, then only we all will become famous, and we all, because we all will be solving the things, and we all will be getting, because everyone here, we will be like writing a paper or words, right? That is very easy part. That is the very easy part. The thing is that once you write a paper, next point comes, like, how many citation did you get it? And once you are getting the citation, the people in academic, they will ask you, what is your H factor? And once your H factor start improving, they will ask you how many, like, what is your contribution to the policy? And once you start contributing to the policy, then they will be asking you how much, like, what are the funding you are getting it? Did you get any funding? And if once you are getting the funding, they will be asking you, okay, how many international funding did you get it? And then ultimately they will ask you what the intervention you have done. How, that means what the impact you have made. So this is what is the whole journey in the academic section. And this is what drives us to write a Lancet paper. Then everything stops. So always be like a solving to the something that will solve all the problems. So this is what is the 4 different type of the research questions. Similarly, when we go with the relationship, like someone is interested whether A and B is effective or not, right? someone is interesting whether A is work or not, whether A is more effective than B or not, right? That is kind of a relationship they are looking into it. That is what is called as an association kind of thing. Dr. John, I asked you the question. The answer to that is the because you are looking for a association kind of thing. And in the association kind of thing, okay, RCT, which is the topmost one, which provide us a highest evidence. That's why you choose the RCT. The cohort study, you should also go for the cohort study, where you few people does, but what if it is there, that is also provide the highest evidence. And the case control, these are the three studies which help us in understanding the association between the study. That's why you choose it. And it is very weak for the cross-sectional study about the association. It is only for the prevalence. So this we should be very clear. So if we are doing such kind of things and we need to put a research question on that, then we need to, how we are going to frame it, that's what we need to understand. Why? Because A is having an impact on B, B is having an impact on A or the C. So that's what we need to understand. So this is what is the different type of the research question that we need to frame it. Is change in diet related to the increase in diabetes in India? What risk factor are associated with compliance to medication? Do person with diabetes drop out of care because of poor access? Is diabetes an independent risk factor of CVD? Right? So precise it is. If we want to understand something, we do not know, we want to understand something, that's we call it a descriptive study. That's what with the experience, the qualitative thing kind of thing, where we need to understand what does the some other person is thinking of. We need to start with how did the intervention increase utilization for care. If you want to understand the intervention, does the intervention is effective or what? So you can say, how did the intervention increase utilization of care? How do patient perceive or understanding having a diabetic complication? What is the quality of life for a person with diabetes in India? What is the lived experience of person living with diabetes? Right? So how precise these questions are, which will help you in framing the whole research study. Change and emancipation, like that means if one is doing one kind of thing, it has an impact on the other. What is the role of social accountability to empower communities? How are patients empowered to self-manage diabetes? Then mixed kind of thing. How did the intervention increase utilization of care and why did this change occur? How do patients perceive or understand having a diabetic complication and how does this affect their psychological well-being? What is the quality of life for a person with diabetes in India and what factor contribute to this? Or what is the lived experience of person living with diabetes and how can they be empowered? Right? So this is what we learn, the different type of the research question, that is a descriptive, relationship, association or causation type, interpretive kind of thing, understanding, change and emancipation, and mixed research question. Okay. So this is what are the different type of the research questions are there. So this is whole about the type of the research question and all. So over to you once again. Let me know your feedback on this. Any doubt, any clarification? Over to you. Yeah, any doubt, any clarification? Okay, I can understand a lot of things are there. Okay, so okay, no problem. So this is what, so here is the assignment for you. So from the day one we used to provide the assignments. So this is the fourth thing that you do right now. We did it. Okay, the topic, the research question, change and emancipation from Amrita to everyone, change and okay, we will discussing. These are the thing, the four thing that you did it right now. Along with that, I'm going to share you with all the slides today also. And these here are the few things which is not there in the Notion link that I have shared with you all. So I will be putting everything, all the materials in the WhatsApp group that we have created. Okay. So you are an SRMA 77 group. There I will put this research question and all. The task is that based on this understanding, and you will all will be getting the recording of it. I want you all to frame your research question based on the topic. Okay. And in the next class, we will be discussing about more, dive into your own topic. And if you want to discuss personally with me about your own topic, then time is around 2 to 4. Okay, you just drop a message either in the group that I want to discuss. Okay, I will fix a time for you, and the link will remain always the same. This will be the link. Save it kindly. We will be again repeatedly we will be posting in the group. Always the link would be the same, even though for the personal or the group classes, the link will remain the same. Yeah, any doubts, any clarification? Amrita has one doubt, I think. Change and emancipation. See, Amrita, like it is, we are talking about the research question. It is a change and emancipation. That means if, like, for example, if we are going to improve the knowledge of the ASHA, how does it has an impact? That's what we are talking about. Okay, let's say you tell the ASHA right now, the we are providing the this tab to the ASHA, right? So what impact does it has? So you are doing one thing, another thing. Like for example, what I am doing, I'm doing the impact. I am providing you the information, and after a certain period of time, you all will be able to draft a systematic review, right? So this is called impact and emancipation. The research question for this is that, is the effective education on is the effective education, or is online education on systematic review is effective in learning the systematic review, or is it a wide method to write a systematic review? So when we are doing one thing and we are getting the outcome, okay, that is the change in emancipation. Okay, that is called as change in emancipation. You do one thing and getting the outcome. Is it clear, Amrita? Could not understand the assignment. Okay, we will be draft you the assignment. Let me explain to you once again. So today we did 4 things. First, we select the topic. Second, you guys frame the research question. Third, you tell me what are the type of intervention. Okay, what are the type of intervention, like what are the type of systematic review that we did it, and you also tell me why that systematic review. Now this is the 4 things we did it today. The assignment is that today we discussed about the research question. So I will be giving you all those material to you in the group. You need to draft a nice research question based on the content. That is the assignment. That is the 4 question that we did. Along with that, the research question. So 5 things should be there, and you need to post it. Okay. So how you need to do it? I will be sharing, I will be creating a one drive link where you all create your own I will giving you all the instruction in the WhatsApp group. Create your own folder, and your own folder you put the material, and the purpose is to everyone will be seeing each other's material, so that that will be the peer education. Okay, and based on that you will be uh, like I will be understanding how far you are going with the whole activities and all. Is it clear? Don't worry, I will be putting in the WhatsApp group also. Yeah, so one research question or one yeah, one research question should be there, and you are doing one study, right? So one research question should be there, not for each question. So you should have one research question for your topic. Okay, for your topic one, like if you want to go for the prevalence of it, so so what is the prevalence of diabetes in India? That is the one research question, right? That in that way you need to proceed. Okay, yeah. So is there anything else? No. So so that's it for the today's class. So hope you guys have enjoyed it, and we will be texting you in WhatsApp group and email you about the assignment. Please take out at least of 30 minutes for your own systematic review and do it. And in the meantime, if you have any doubt, any clarification, post it in the WhatsApp group or direct email to me, so that we will be prepared for that, and in the next class we will be resolving that. And regarding your recordings and all, it require approximately 24 to 48 hours to process by the system. And so that's what you need to wait at least of 48 hours to get the systematic review. Sorry, to get your recordings of it. And I will be posting each and everything in group. Thank you. Thank you. Have a nice day. Keep learning.